My message for you out there is that we should wash our hands in the proper way to ensure that we don't spread disease. It takes only seconds. Seconds saves lives. Go out there, clean your hands.
Um, a hand hygiene story, I think, is one that I'd like to use to encourage people to just start wherever you are at. In 2009, we decided, myself and my team, to introduce a alcohol hand rub program into the University of to the Lagos University Teaching Hospital, and we decided to first of all understand or to do a situational analysis. How many people are washing hands? And we decided to do some observations, and we looked at moment 1 and we looked at moment 4. We chose moment 1 because moment 1, really, the way we figured it, before you touch a patient, if people are doing that, it means they really understand that you need to break transmission from one patient to the other. And then we did moment 4, which really speaks to self-preservation many times. People wash their hands after touching a patient because the healthcare was they don't want to get infected. And what we found was that moment 1, only 15% of staff across the whole hospital, which is a 761 bed hospital, were cleaning their hands before touching a patient. And this went to about 45 to about 65%, depending on which ward you were in, after touching a patient. So we got approval to do both the intervention and also to provide alcohol hand rub. And let me just say that we haven't looked back. We've had stops and starts, we've had people, but Luth has consistently since then had alcohol hand rub at point of care. There were periods when we had logistic issues, but the whole idea is let's start and we solve the problems as we continue to as we work out all our kinks and so on. So I would like to use that story to encourage all of us. Doing the observations do not cost money. It's about time and understanding how to do it. So if I can say something today is all healthcare workers here in Nigeria should please go ahead and start to do these observations. Have data to use to convince your policymakers so that they do see that we're not washing our hands. Because when you ask people, they always think they wash their hands more often than they do. And when you really observe them, you find that, yeah, they may, but not always at the point of care. And it's really at that point of care that we really need to be washing our hands to ensure that we're not transmitting infections to vulnerable people. So I hope that helps.